Hello, my name is Jillian Mason, and this is the Medicare for All podcast, a podcast for everyone who needs healthcare. And for this episode, we are going to be going back to a familiar villain from podcast past, because unfortunately, healthcare villains have a habit of staying relevant. So this is a guy who made his fame by cozying up to Oprah while shilling diet pills, supplements, and medical conspiracy theories. That's right, it's Dr. Oz, who is now Trump's nominee for director of the Center of Medicaid and Medicaid Services. So that's right, the man who has previously claimed that there are deadly levels of arsenic in apple juice, that most olive oil is fake, that reparative therapy, quote unquote, can cure, quote unquote, homosexuality, and that hydroxychloroquine cures COVID. He said all these things, and this man now is pretty close to running our largest public health systems. So today I'm talking with Dr. Diljeet Singh of Physicians for a National Health Program about what it means for you and the country at large and how we can do something about it. I'm going to introduce my guest in a second, but I just wanted to make a note that at the Medicare for All podcast, we've had a brief unplanned hiatus due to pesky technical issues and the fact that Trump is keeping us running in our organizing work. But we're very excited to be back. I'm flying solo today while my regular co-host Ben is saving the environment at his 9-to-5 organizing job. But that feels like important work as well. So we're going to give him a pass and send him all our love. But luckily, I have our distinguished guest to keep me company and help me unpack the latest Oz nonsense. So Dr. Diljeet Singh is a women's health advocate and integrative gynecologic oncologist and the president of Physicians for a National Health Program. She received her medical degree from Northwestern University and her master's degree from the Harvard School of Public Health. She completed an obstetrics and gynecology residency at Johns Hopkins and a gynecologic oncology fellowship at the MD Anderson Cancer Center. She's completed her doctoral degree in public health on cost analysis at the University of Texas School of Public Health and an associate fellowship in integrative medicine at the University of Arizona. Welcome, Dr. Singh.
Thank you. Thank you. Good to be here and glad to be talking about this.
Yes. Well, I mean, glad and not glad.
glad that we're going to try to give people some information that they could use.
There we go. That sounds great. So yes, why don't we actually start out with you though? You haven't been on the podcast before, so I'd love it if you would just share with our listeners, how you came to do the work you do, both as a doctor and also as a fierce advocate for public health care.
I had been practicing gynecologic oncology for a few years in Chicago. And, when I was a med student, it was clear to me, there's something wrong with how we do healthcare. Why are we spending so much money? Why doesn't everybody have coverage? And at my, little baby medical self, I really thought it was just that we didn't have enough information. We needed to do better research. Of course, this is what you learn in med school. So that was one of the reasons, when I was going through my training, it was while I was a fellow at MD Anderson that I actually got my PhD in cost analysis, because I was convinced, if we just did cost-effective care, then we would be able to actually do good by people and give them what they need and give them the longest, best quality lives that American healthcare is promising people. And it became really apparent to me that in America, there's no such thing as I want to say it. There's no such thing as legitimate cost analysis research because the costs are completely hidden. We make them up. The charges are made up. They're made up for insurance companies. They're made up by hospitals. All of the numbers were fake. I didn't even publish my PhD because I was this is not legit. And and then I got into practice and it was clear, the thing that's actually wrong is that in America, we don't believe in universal health care, which everybody else believes in, and we choose to spend a bunch of our money on profit, right? There's no reason, of all the businesses, and I am totally, when it comes to cars and iPhones and iPhones and jewelry, I am all for capitalism and people making money doing their craft. healthcare is just different. And it was obvious to me. And I don't know, that's a very long way of saying, like, I showed up at some like meeting at the Illinois state capitol, and there was a bill that was going on. It was for universal health care in Illinois, free of profit motives. And I don't even know what drove me to go down to Springfield, but I went and I was down there, and this great guy, Nick Scala, who was one of our organizers. Right?
Firmly active in healthcare now as well. Right? Yeah. Rest in power, Nick. Yeah.
Absolutely. Anyway, I was so lucky. He literally came up to me because I asked a question or something. He was like, "So you're a doctor and you're from Chicago? I have an organization for you." And he did. And so I've been with the organization ever since. And I think the truth is, like, we deserve universal health care, free of profit motives, where the focus of everything we do is taking care of people. And I just can't even tell you, like, taking care of patients, like how it feels to know that they may or may not be able to afford their medication.
Yeah.
They didn't show up for 6 months with their bleeding because they didn't have coverage, or they were waiting to fulfill their deductibles, or some stupid financially driven reason for not taking care of themselves. And as someone who takes care of women with cancer, it's really challenging, right? Like, maybe
there are a lot of tense timelines and stuff, right? I mean, there are a lot of tense timelines and stuff, right? If someone can't afford to get their medication at the moment they need it, right? It's a disaster.
No. And when I was doing my basic treatment, like, we used to talk about, like, the time from, finding out you have cancer to starting your treatment, that the shorter we could make that, the better our chances of cure. And we had a whole process of, like, the second we heard someone had cancer, like, how quickly could we get them in the office? How quickly could we get their scans? Like, how quickly could we get them to the operating room to get their cancer out? That stuff's, like, just been thrown out the window. Like, nobody gives a shit anymore. Why? Because if you want to clip somebody's fingernail, you have to get it pre-authorized.
Right.
And so, like, if it's like, whether it's their scan or their blood test, even their, like, vitamin D level, you name it, it has to be pre-authorized. And who knows how long that's going to take. And yeah, anyway, being a clinician is what makes me be a health.
So in some ways, you're an activist in order to solve your workplace problems.
Absolutely. Absolutely. That is my dream. And then, like, once I'm done with that, then we're going to focus on cancer prevention and get rid of cancer. Then I'll really be able to be a full-time advocate for something else.
Well, we are so deeply appreciative of the work that you do, both in and out of the clinic, and really, it's always so touching from someone who, like me, who got involved as, like, a victim of the healthcare system, to hear doctors actually talking about, the kind of issues that their patients face, and to know that doctors are seeing, hearing, and actually acting on what they see is just, like, it's really valuable for me. And I'm sure to a lot of our listeners who are thinking, I have healthcare problems. Does anyone care? We're here to talk about another doctor, though.
We are. He's a member of my profession. I have to own up to that.
Oof. So Dr. Oz is back again. And as we said, this time as Trump's nominee for the director of the Centers for Medicare and Medicaid Services. But before we actually launch into all of the Oz of it all, can you just describe the job he's up for quickly, and, like, what a director of Medicare and Medicaid Services actually does?
I literally, like, had to Google this at some point, I think. Because I know what they do when I think of the advocacy work we do. And, we want to talk to the director of CMS because we want to advocate for blah, blah, blah. But what's really interesting is he is going to literally run Medicare, Medicaid, the Department of Health for Minority Services. But these are basically our public health infrastructure.
Yeah.
He's considered to be, responsible for financial management and resource management and making sure we're using our resources well. And the irony of that, to me, so so challenging.
He has a lot of money. So
we ain't going to get his money to take care of people for sure. I guarantee you.
I don't even really think it's his money, actually. In fact, he married into most of his wealth. So just putting that out there.
I will say this, I think maybe in the beginning, but at this point, he has made so much money off, the supplements and other crap. And as an integrative medicine doctor, I 1000% believe that there are things that we can put into our body that can help us.
Yeah.
But the idea that some of that shit doesn't do anything and has never been proven to do anything, but the only reason he sold it was to make money. And then he's deeply, deeply, deeply invested in for-profit Medicare.
Yes. Yes.
Right? And then this is the guy we're putting in charge of Medicare.
I mean, he and his wife own I think it's $550,000 worth of stock in United Health Group alone. Another.
I think the numbers are crazy.
Health. Yeah.
But we get into the millions as we talk about. He while he was still on his show, he was literally being paid as a sponsor for Medicare Advantage companies, and talking about it as though he was an independent physician making good decisions for the people he took care of. It's kind of outrageous. So
yeah,
right.
So the idea that he's in charge of finances is particularly
right. I mean, that part just blows my mind. And then, so many people have said to me, but aren't you at least happy the guy's a doctor?
Are you?
I'm not, because I think that he left behind the primary goal of taking care of people a long time ago.
Yeah.
Right. And I will say this, did he ever do any good by putting out good public health messages? And does he occasionally say things about preventive medicine that I think are valuable? Absolutely. But he clearly went down that path of, I'm in this to make money, not to do something good in the world, not to take care of people. And I mean, I think that's the really challenging thing about American medicine in general, though.
Yeah.
That we think it's legit to have it be completely for profit. And we think that if we go back to the basic concept of, I'm a doctor, somebody walks in my door and she has cervical cancer. And as we sit and talk about what are her treatment options, what can she do? What are the best tests to figure out what's going on? The thing she needs to know is that I'm only thinking about her.
Right.
Her meeting her goals of care, me understanding what she wants and helping her get there.
Mm-hmm.
Right.
Mm-hmm.
But if I work for whatever company I work for, all the NDAs I've signed over the course of my life, but you can imagine.
Now I'm imagining.
Worried about, and I'm forced to worry about how much money they're making, how many PET scans I'm allowed to order, what's expensive, what's not. And I'm having to do that stupid math in the back of my head the whole time. That's not what patients want. Yeah. Patients want to know that their doctor has no conflict of interest, that their doctor is doing what's best for them. And that's what they deserve. And the truth is, that's what doctors deserve. Doctors deserve to take care of their patients, not have to worry about how much money this organization wants to make and what United Healthcare allows and what drug is, connected to somebody's pharmacy benefit manager, blah, blah, blah.
Yeah.
Doctors deserve to just make the best medical recommendations that work for somebody. Anyway, we're going off on this tangent, but it's because to me.
Oh, it's not a tangent. I think this is very core to what we're talking about. So keep going.
That's the opposite of who Dr. Oz has proven to be, right?
Yeah. Yeah.
Everything he's done was to make money for himself. There's nothing in which there's not like a clear-cut conflict of interest.
Yeah, I say this all the time on the podcast, but for-profit healthcare has really corrupted the relationship between doctor and patient, right? And so the more people see doctors like Dr. Oz on TV, who are selling things, who are clearly chasing that profit motive, as you said, right? The more they start to think that, well, maybe that's what all doctors are doing, right? And so, I've frequently talked to people in South Texas where I live who will say, oh, that doctor is just going to try to put me on some medicine because the big pharma company wants to make some money or whatever. And it's like, well, maybe so, but maybe you need a statin, like maybe you need antidepressants, So yeah, I think that it's something that it just impacts dramatically doctors and patients for sure.
Well, and I think like that whole, wellness industry, right? We think, oh, Dr. Oz and even, Nutcase Kennedy, that they are saying these brilliant things when they say like, oh, we should clean up the water. Oh, we should make the food supply better. Yes, we should do those things. But if you're going to be paid for whatever you've decided is a magical preventive medicine thing to work, then we just can't trust you to make good recommendations.
No. And in that way, I've been thinking about this more and more lately. I think actually for-profit medicine is actually bad for the wellness industry as well, right? Some of these things, like, for example, different, like the turmeric example, right? In general, pharmaceutical tests are captured by the big pharma industry, right? And so frequently things that are like natural medicine or outside of, they don't get the kind of testing, right, that would demonstrate whether or not they are actually effective,
Well, they don't get testing because you can't make $1 trillion zillion off vitamin
C. Exactly.
But I will say this, I think the wellness industry has also been stolen.
Yeah.
Right.
Yeah.
Like when I first did my integrative medicine training, I want to say how many years it's been. I finished in 2010, I think. I finished, I've been a GYN oncologist since 99.
Mm-hmm.
99. And, part of the problem was American medicine, because it was disease-based and because we only took care of, we basically gave up on wellness and lifestyle. And that was because of how it was structured, how we did the billing, how hospitals, right? And so the basic way we built this for-profit system made us think that only diseases were worth taking care of. And so then we gave up on all of this preventive medicine stuff. So then other people picked it up.
Yeah. Yeah.
And on the one hand, you go, thank God somebody else picked it up. But then if that person picked it up and they're in the business of selling something in a bottle or selling something in an IV, not just earn a living, keep a roof over your head, but I think I want to make $1 trillion doing this or whatever. Then they become untrustworthy also. And I do think that's how the truly crazy stuff starts happening, right?
Yeah.
The fact that RFK, I don't even like calling him RFK because that's not the real RFK. But anyway,
I know it's so insulting.
Right, that shows my age. But the the way he's been able to kind of worm his way, funny word choice, into this part of our culture where people trust him, right? Because some of the things he says are true. But then meanwhile, a lot of the things like this whole anti-vax thing, he is making money by suing companies. And so even his opinions on vaccine have a built-in conflict of interest because he's making money off talking people into getting measles. I mean, 2 people have died of measles in America. What the fuck? Right? What happened?
Yeah, no, I can say it louder. What the fuck? Yeah, no, I mean, again, living in Texas, right, we get to see the best of the American healthcare system, of course. And yeah, this measles outbreak is crazy. And it's affecting our children. And it just kills me that people are willing to let their children die for this bullshit anti-vaxxer idea.
Right.
Crazy.
But it's not like let their children die. It's that they don't trust
any
sources of information. And like we were talking about, there's a reason not to trust, because there's all these built-in conflicts of interest. So you don't know, right? And for me, that was one of the most horrible things, because at least in the past, we could trust our public health organizations because they weren't making money, right? The CDC was not making money when it put out recommendations. The U.S. Preventive Task Force was not making money when they told us what kind of tests we should do or not. They don't sell mammograms. They don't sell pap smear. And now we're taking our public health organization, the Center for Medicare and Medicaid Services, and turning it into a for-profit organization run by somebody with conflict of interest like built into his being.
Yeah. So it sounds like that might be like important stuff to ask Dr. Oz about if you were to be doing his job interview, for example. And I think that folks might already be aware because of the kind of ridiculous procession of nominees that Trump already has put in place, shout out to RFK Jr. But the process for the presidential nominees, for folks who don't know, is that the president selects his candidate, and then the candidate has a hearing before the Senate committee that has jurisdiction over that position. And they grill the candidate, and then they confirm or block the nomination. So in this case, it's the Senate Finance Committee, and the hearing is, as we're recording this, tomorrow morning. So if you, Dr. Singh, were a senator about to have a chance to interrogate Dr. Oz, what are some of the questions you would want to ask him?
So I just want to be clear that hearing is going to be complete and utter bullshit.
Yeah.
Right? Like, there's going to be people trying to make a point. Oz is not going to actually answer any of these questions. I mean, I think the time when we could have expected that people would say the truth is gone.
Yeah.
And we know that's true, like from the Supreme Court justices that said they weren't going to take down Roe.
Yeah.
Right? Yeah. So I think the idea that if I asked a question of Oz in the Senate hearing committee, that he would tell me the truth in any way that mattered is right. Like that part is gone. I mean, I think that's why we're doing our shadow hearing. We have to talk about that too. But,
yes, absolutely.
But if I were, I think I would ask about all of these things. Like, why does he think it's reasonable to waste 30 cents of every healthcare dollar on profit that doesn't make anybody any healthier? Why does he think it's reasonable for people in America to go without basic healthcare? And, why does he think that a company whose business is making money, not providing healthcare, should be expanded, right? He believes and it makes me insane how good at spinning shit he is, because that was his talent, but like Medicare Advantage for all, like people mix that up with Medicare for all, which is the idea of universal health care for everyone, free of profit motives. And we'll just stick that little advantage word in there, which everybody wants an advantage. Advantage sounds like a good thing. Well, Medicare Advantage is not an advantage. No. And there's so much research showing that
Medicare for Advantage, by the way, for folks who Medicare Advantage for all is what Dr. Oz proposed as his healthcare platform when he was running for Senate back in Pennsylvania, which is when the last time that we talked about him on the podcast. But yeah, so the idea is
the piece that's in Project 2025.
Exactly, right? It's the idea is to expand the privatization of Medicare, right? And basically just turn over the taxes that we pay for Medicare, right? To private insurance companies and let them do what they will with it, right?
Right, which any working person in America who who has a job right now is putting money in, and 30 cents of every one of those dollars is going into somebody's pocket. And, it makes me crazy, Jillian, like the idea that, like back in my little public health days, we used to always talk about like limited resources. There's limited resources in healthcare. We have to make better use of our limited resources. And I'm saying it like that, not that I don't believe it. Like obviously I believe we should practice cost effective, that we should give people tools that work, not waste the investments that we're making in our own health. But United Healthcare does not believe there's limited resources. They think that they can make as much money as they want, and that this year they're going to make more money than the last year.
Yeah.
The CEO of United Healthcare, like getting on investor call the day after, they got broken into by one of those crazy, and I'm not a computer person, but essentially
this was the Russian hacker thing. Yeah.
So and because of that, their systems were down. So people couldn't get their care. There was delay in receiving whatever it was. Doctors' offices, hospitals didn't get paid. And he went on this investor call and he's saying, hey, that was awesome. We made some extra money in those couple days because we didn't provide healthcare.
Yeah, that's
again, like you come back to that, like what the fuck? Like that's because that's the business they're in, making money for shareholders, not providing healthcare and taking care of people.
And literally, the only way insurance companies make money is by denying care, right?
Absolutely.
That's the only profit source for them. So they make zero money when they provide the care that they're supposed to.
It's really interesting. Like I think the whole term healthcare insurance, like every one of those three words is false. It's not health. They're not interested in health. It's not providing care. They're not interested in that. And it's not insurance in the sense that, like, I get fire insurance on my house because there's a small chance there'll be a fire, right? Yeah. But mostly, like the money I put in and why it works as an insurance thing is because most people don't use it. So then the one person who does have a horrible disaster befall them can use the money that the rest of us put in the pool. That's not what we're doing in insurance, right? Like we want people to use their health care. We want people to get their pap smears. We want people to get their mammograms. Yes. We want people to get their, cholesterol checked. We want them to take their statins if that's what they need. And so it's not like for a rainy day, for a horrible event. Everybody needs to use health care. So it's not insurance. And again, like that's why I said, like none of the words fit the freaking business that's going on. And I can't think of a good name for it other than like to steal the money of the people who are in need. I mean, I don't even know how to describe it if you don't use those words, right?
I mean, I'm from New Jersey, and back there we described it as a long con.
Yes, short and long, depending on where you are.
Depending on how fast they can kill you. Sorry, dark. I mean, so we've talked about this. We've been talking about this the whole time, but just like kind of to reinforce, like, we're in this crazy moment in our culture, just a wild, wild moment with everything, but healthcare is definitely part of it, right? Like, we were talking before the show about Luigi Mangione and how this kind of touched on a kind of, a nerve in American society. And you were saying that you see Dr. Oz as kind of like a microcosm of all the things that are wrong in our system. Maybe not all the things, but many of the things that are wrong in our system. Do you want to elaborate on that a little bit and how this
I guess what I'd say is, it is no secret that healthcare is broken in America.
Yeah.
Right. Yeah. No matter who you are, no matter how healthy or not healthy you are, you make decisions about your health based on your insurance. Again, quotes. And the idea that these people would take advantage of the pain and the suffering that people have and say, oh, we know it's broken too, and so we're going to fix it for you. And how are we going to fix it? We're going to give more money to United Healthcare. And somebody's going to pay me on the side because I'm a sponsor or whatever, but you're going to trust me because I'm a doctor. I mean, I think that I don't know. I think it's really, really, really hard to be a regular person and to try to understand, like, who can you trust and how do we fix it?
Yes. Yes. Yes.
what I'm going to say is it's actually not that complicated. Like,
Yeah.
number one, let's just eliminate conflicts of interest. You never want your doctor to be worried about how much your PET scan costs and how much this costs. Not that they're doing crazy shit. You want them to be good doctors and pick the right tests and not make you do stuff you don't need, not expose you to unnecessary risk, but that their interest is your best quality of life. Your health goals are what they're. So let's get profit out of it.
Yeah.
Right.
Yeah.
And then let's think about, how do we make ourselves as a people, as a society, healthier? Give it to everyone. Make sure everybody, if they want their vaccines, can get them. Right?
Yeah.
Make sure everybody like starts out learning like, these are the foods that are good for you and these are the things that are bad for you. Understand, like, if you do 30 minutes of activity 5 times a week, you have less chance of dying of cancer, diabetes, or heart disease. 30 minutes 5 times a week is not that much. But that basic idea of universal access, where there's no copays, there's no deductibles, nothing you have to think through about like, is it worth it? Or do I need to, buy a computer for my kid? Do I need to pay the electricity bill? Or should I get my mammogram? And let's face it, I know all of those women who chose not to go in when they had abnormal bleeding, not to go in when they were having pelvic pain, but because they couldn't quite like make the copay right then, or they needed to put that money somewhere else, right? So I feel like we make it all complicated. It's not complicated. No conflict of interest. That means no profit motive in healthcare. Universal access. Everybody gets it. Period. Done.
Amen. Amen. That actually, you're right. You're right. It is so simple. And yet we're the ones who are the crazy bureaucratic communist, whatever, in their minds. So yeah, you're right. It is simple. It is just that simple. Getting the profit out, getting that conflict of interest out, and restoring the kind of trust. I like what you say about that. Like, every ordinary person in the country right now, I think, is thinking, and again, on a lot of issues besides healthcare, but healthcare especially, right? Who can I trust, right? And in terms of who I trust Physicians for a National Health Program, which is the organization that Dr. Singh is the president of. Y'all, knowing that the official confirmation hearing for Dr. Oz is likely to be complete bullshit, you have planned your own event at the same time as his hearing tomorrow morning. And I wondered if you could just, tell us a little bit about that, about what's happening, and
So we're calling it a shadow hearing, and we're doing it with a bunch of partners. The primary sponsor is actually Social Security Works, and we're just going to talk about it. We're just going to ask the questions that we would want asked. We're going to hear from people who've had health problems. We're going to hear from healthcare professionals and providers. And it's going to be an opportunity to learn and talk, and hopefully entertaining. I don't know. It's hard to say entertaining around this. But hopefully help you get some messages and ways that you can talk to the people in your life who you feel like could benefit from having more information about this.
And who couldn't, because there is so little information about this, out in the mainstream world.
Right. And again, right, PNHP, right, has no investment in any of this. You don't get money from United Healthcare. Nobody giving us the money other than our members, who are mostly physicians. And, if you want to support an organization like PNHP, we do have non-physician members. And we welcome you to join. Check out our website, come to our events. There's chapters all over the country you can find on the website if you want to do local work. And we have students for a national health plan, our student group, and they are amazing and brilliant, and they just prove that there will be people to take care of everyone if we just can make sure we don't let our system die.
Your medical students are just the best. I get to do trainings with them every summer, and it's like the best part of my summer. They're amazing, just amazing. Super duper cool. So, all right, great. So we have this shadow hearing that is coming up tomorrow. As you said, though, the hearing is likely to be bullshit. And if the pattern sort of holds with Trump's other nominees, right, we're looking at the likely nomination.
Yes, absolutely.
Right? Yeah,
absolutely.
So we're not delusional, right? Like we know what's going to happen, right? That being said, after the hearing, right, what is it that we can do to hold this maniac accountable?
So, there is going to be a Medicare for All bill that's coming out. I don't know if I'm not supposed to, but there's been an.
There will be. Yeah.
Right? So say that, right? Our, Senate sponsor, Bernie Sanders, Kamala Jayapal, the two of them are working on it. I think that's an opportunity for us to say, this is what we want.
Mm-hmm.
We want universal health care, free of profit motives. We want it now. And we need to talk to our legislators. We need to talk to our senators. And then we are just going to have to keep our little eagle eyes on everything that CMS does. If they try to privatize Medicare, we just have to jump and shout and talk and gather and write and call our people and our friends and engage everybody in that process of thinking, talking, and protecting, what we have.
Mm-hmm. Mm-hmm.
And, I think that, we were talking a little bit of how it's simple, but how we make it complicated. This is the part that's tough. I think I don't even know how to say it well. The thing that will happen are little rules will get changed, right?
Yeah.
CMS is allowed to do a lot of things without Congress. Elon Musk is doing a bunch of shit he's actually not allowed to. Well, CMS is actually allowed to do some evil shit in terms of pushing people onto these privatized for-profit plans and limiting their access to care, allowing them to be subjected to delays and denials. And so we have to watch it. And we just have to stay in communication as people and make sure that as these things happen, we push for what we really need: universal health care, free of profit motive, period. And every single time one of those things happen, unfortunately, we're going to have to defend it, just like we're going to have to defend the National Institutes of Health and the National Cancer Institute and make sure that research keeps happening. It breaks my heart, the idea that they're going to have somebody with cancer, a child with cancer, in some way represent the things they're doing, when meanwhile they're taking away the research. Might have been what provided that child his cure. That's going to give him, I'm referring to a child who wants to be a police officer and who was at the State of the Union or whatever they call it.
Right.
And so the idea that we would kind of on the down low, eliminate all this funding for research, take away all of the important work that's being done. And the way, most discoveries in America, most new drugs, they do not come because a pharmaceutical company does it, right? They come because the National Institutes of Health and our academic research organizations do research, from the little basic gene research up to the actual drug that saves lives, right? Even in ovarian cancer, from when I started 26 years ago, we've gotten better at keeping people alive for longer with better quality of life. It's a dramatic difference. And it's because researchers at NIH and universities all over the country did clinical trials. Well, first discovered the drugs, discovered the genes, then we did the trials, and then people signed up for those trials and took those drugs, and we proved that we could do some things better. And all of that stuff is being taken away. Right.
Yeah, no, I mean, you're right. It's coming from all directions, right? From attacks on the public healthcare system, to attacks on public funding for healthcare research, to attacks on the bodily autonomy of women, femmes, and people who give birth, and then also trans folks as well. And so it's just constantly under attack. So I'd like to make a quick pitch, if I could, for one of our healthcare down projects is called HEAT. It's the Health Emergency Action Team. And you can go to our website and sign up for it. And we basically send out 3 calls to action per month about national health issues, basically giving you some actions, some of which you can take even from your home, some of which only take 5 minutes, right? That you can do to kind of get into rapid response mode so that we can take on these issues as they come, just as you said. So, yeah.
We didn't even touch on the issue of Oz and reproductive justice and the fact that he is absolutely supportive of everything that's happened in America and does not believe that women should have bodily autonomy, and has made it very clear in how he speaks and how he talks. Yeah.
Keep your hands off my fucking body, Dr. Oz.
Downer.
That's all I have to say. Oh man. Well, there is a lot more to talk to and talk about, and so therefore, I demand that you come on again as a guest.
Absolutely, happy to, and happy to hopefully like have the opportunity even to take questions and whatever.
Absolutely, we can definitely arrange for that. That's fantastic. So again, I want to just thank you so much for the work that you do and for taking the time out in a very busy week to talk with us. I also want to say thank you to our podcast team, our all volunteer podcast team. We've got our podcast manager, Angelique Davis, our show notes writer, Jerry Katz, and our audio editor, Craig Stanton. Remember to like, subscribe, comment, and share with your friends. And also a reminder that this podcast is a project of the Healthcare Now Education Fund, and you can support the pod by going to www.healthcare-now.org and clicking on the donate tab to send us some love. And you'll also find more information there about the shadow hearing as well, linked to the PNHP page about that, so you can register. All right. Well, thank you so much again. And stay safe and stay dangerous.